listening to the Pharmacy Podcast Network.
Welcome to the Pharmacy Podcast Network's coverage of the NCPA 2025 Post Show. The NCPA annual conference is the trailblazer for community pharmacy, bringing together the pharmacy community. Our host, Todd Eury, founder and CEO of the Pharmacy Podcast Network, took the microphone to the action right on the show floor, capturing exclusive conversations with attendees, pharmacy students, keynote speakers, vendors, and more. You don't want to miss this three-part series starting right now. Thank you, NimbleRx, for sponsoring this episode of the NCPA Post Show.
Scott Von Dalen, NimbleRx, and welcome to the Pharmacy Podcast Show.
Scott, we are here at the NCPA 2025. It's so exciting. Last time I got to spend time with you was at our NACDS show. You're back for NCPA. Great to see you.
Great to see you, Todd, as always.
New Orleans, this has been fun already. I got to spend time with some Pitt pharmacy students last night and hanging out on Bourbon Street. Talk to me about why NimbleRx, why you guys invest in NCPA. Why do you come to this show?
That's a great question. I mean, obviously, like any vendor, we're here to try and obtain new customers, but NCPA is special because NCPA is that, as everyone knows, that governing body of independent pharmacy, right? National Community Pharmacy Association, and it's really important to support NCPA and the initiatives that they're out there, on the ground getting after, particularly when it comes to the current legislative fight up on the Hill and at the state level, to support this organization that's supporting all of the men and women, the individual owners throughout the country to fight the good fight against the PBMs and that reform that's going on, reimbursements, and just having that governing body in place to sort of, carry the torch forward for this group. All right, so I'm hearing a lot about the growth of NimbleRx. Last time you and I talked, you were talking to me about how the chain pharmacies are starting to grow. They're starting to implement the e-commerce, the connection to patients, connection to people. Talk to us about the independent community pharmacy and how Nimble's been working with those pharmacies. It's been working well. So 2 years ago, I started my journey with NimbleRx, and we had a network of pharmacies, but since that point in time, it has 10x'd with the number of true independent pharmacies that we're working with in their communities, respectively. And, it's a big transition within the workflow of the pharmacy and how they service patients and allowing patients that option to fill and pay for their prescription in advance of either stopping by the pharmacy or just having it delivered to their front door. Seamless. It's no different than I always compare it to DoorDash if you were a restaurant, and driving that business, making it easier, removing friction from the customer experience as well as removing friction from the pharmacy workflow. So it's going really well in independent pharmacy as a whole. Talk to us about implementation and getting a demo, understanding how to implement this, how to tie it into my pharmacy management system, and then moving forward with your average community pharmacy out there. The implementation process is really smooth for new NimbleRx customers. So we have an integration with virtually every pharmacy management system in the industry. So when you sign an agreement with Nimble, it's free of charge. We give you the data form for your individual pharmacy management system, whether that's Pioneer, RX30, et cetera. We set all that up in the back end. There's no fees for that either. We absorb that cost from the pharmacy management system. It takes us 3 to 5 business days, depending on the system, to get everything integrated, connected, so we have access to your data. And then we have a 45-minute onboarding call a week later and go through that initial training / launching process where we then decide what date are we going to go live and start texting customers about their prescriptions for the very first time. Customers are fickle, customers are impatient. If there's not a mobile option, what happens next? Do you have, just for our listeners that aren't using Nimble, talk to us about what happens with that decision making in order to make purchases, to make it convenient for the consumer, what they're missing out on. It's really convenient for the consumer, right? Because they've been going to a pharmacy probably for years, and then one day out of the blue, they get a text from their pharmacy powered by NimbleRx saying, Todd, you have a prescription that's ready to be picked up. You go through that very simple and intuitive user experience with the Nimble product as a patient. Check out, choose pickup delivery. You can choose from different OTC products that the pharmacy offers to add to your basket, and then go ahead and, as mentioned earlier, and pay. And it's really easy, and just makes life easier for the patient and also for the pharmacy. You had another question in there, and I just skipped it.
Well, I'm always looking for ways to insulate or mitigate the risk of losing opportunities. So if there's ever been any kind of stats that you've seen the rise in mobile usage and people wanting to check things out, and I mean, I'm paying my electric bill, for goodness sakes, via my phone.
Thank you. So the user experience generally is just over your browser. So when you click that text message from Nimble on behalf of your pharmacy, Todd's Pharmacy, for the first time, it takes you to Internet Explorer or Google Chrome. You can download the app. We have one of the highest rated healthcare apps in the Apple Store. It has like 70,000 five-star reviews. It's in the top 10, which is really cool. So the experience, whether you download the app or not, is really seamless. And in terms of stats, when we text patients for the first time, one stat is there's 75% less likely chance that they'll abandon a first-time fill. First-time fills are always a challenge for pharmacies, right? Patient doesn't know if they want to pick it up, or are they going to have a negative side effect because of this new medication from a provider that they're going to. When they get that text and that simple reminder from Nimble, and it's so easy to use, they're 75 times less likely to abandon that first-time fill, which is really cool. And in the reduction of just overall return to stock in a will call bin for those, hey, your prescriptions are ready text messages, that's around 50% reduction in return to stock. So if a pharmacy is returning 100 prescriptions monthly to stock, just as a round number, we'll reduce that by 50%. So it's really exciting stuff, and it's just, to your point, Todd, as much as I'd like to sit here and have the product of Nimble take all the credit, and we do have an amazing product, it really is just where we are in 2025 as a culture that we're all used to, as you just mentioned, paying your electric bill or whatever it is via your mobile device, and so no different now for prescriptions moving forward.
Yeah, and you can't miss out. You can't not have some tool to give to your patient. And once again, I really like that point about first fill, because if I pay for something, I'm going and getting it, or I'm going to get it delivered to me. Whereas if I haven't paid for it yet, it might slip off. Now it's a week, I didn't take it. Physician's like, what's going on? So this is all part of the bigger ecosystem of better health.
Yeah, I would agree with that 100%.
All right, Scott, we'll be back with more NimbleRx here on the Pharmacy Podcast Network.
Awesome. Thanks, Todd.
The American Pharmacists Cooperative Incorporated out of Montgomery, Alabama, has been a member of the Pharmacy Podcast Network for a little under a year. Shout out to Greg Reibold for helping us with the PBM Reform podcast. Bill Ely, it's so good to see you.
Good to see you too, Todd.
All right, this is a challenging time, and I like talking to people like you, Bill, who understand where we've come from. There's a golden age of pharmacy 20, 30 years ago that's really transforming into a different type of pharmacy environment where clinical services and follow-up and packaging and long-term care at home is taking place. APCI has been that conduit and pathway to bring more success and more programs to our independent community pharmacies. Talk to us about being here at NCPA and what you guys are excited about going into 2026.
Oh, we're really excited about the PBM issue, as you talked about. We've been fighting it for years, and with the Pharmacists Fight Back Act that was introduced last year, had 50 co-sponsors within 3 months, which is pretty amazing, to tell you the truth. But we're real excited about coming here to NCPA and talking with everybody. We work in a lot of states and help them with their, I think the Pharmacists Fight Back Act ought to be introduced in states, and because it moves a little quicker in states. In Alabama, we did a similar bill with some reimbursement in the commercial market, and plan on reintroducing the Pharmacists Fight Back Act hopefully pretty soon in Congress.
All right, so PBM reform continues to move forward. Some states are further ahead than other states. Talk to me about kind of the next phase. Are you targeting programs that are cash-based to try to like suck up some of that revenue so that we're not always worried about the prescription? But are there other programs that you've seen success in some of our community pharmacies?
There are a lot of wellness programs that what we try to do is even reach out to employers to get them, because as you well know, independent pharmacy is the most accessible healthcare provider in the world, particularly in rural counties. And we have a lot of rural counties in Alabama. And I think getting businesses to understand keeping their employees out of the hospital saves a whole lot of money. So we've got some programs with I think our state health in Alabama, because we are in 27 states, but in Alabama we have a health wellness program with the state of Alabama for their employees. So I think it's getting the businesses to understand, the business community, that you may, spend a little bit, but it's going to save you some. Keeping people at work if you can find them to come to work, and alike. So I think that's very, very important to expand the role of the pharmacy. Is not just they're counting pills, because we know they don't.
Yeah, exactly.
They're very well educated and can do a lot of things.
Absolutely. Bill, this has been good to spend time with you here at the NCPA 2025. Thank you so much for your support for the network and driving the PBM Reform podcast. We really enjoy working with you guys.
And Todd, thank you for what you're doing. We really enjoy working with you.
Thank you.
Thank you.
Sonia Pagnano, the NCPA Foundation. You're listening to the Pharmacy Podcast Network.
Hey, welcome to the show, Sonia. So good to see you here at the NCPA.
Yeah, it's so great to see you. I'm so glad I ran into you.
All right, NCPA Foundation, give us an update. How have things been going, the growth, some of the initiatives, and then shout out to our listeners ways to get involved.
Yeah, we have a lot of exciting things happening. We are continuing to grow and expand, and that's all thanks to our donors, our supporters, our sponsors. We really couldn't do it without everybody out there believing in our mission. We recently did change our mission, vision, and announce some values you can view on our website. We also are rolling out this weekend actually a Rural Pharmacy Ownership Accelerator program.
Cool.
We'll be accepting up to 15 applicants for that. Applications are due November 30th. Completely free program. It's set up just like our Pathways to Pharmacy Ownership program, but it really focuses on that rural pharmacy ownership piece that I think is going to be so important, especially for that next generation of owners that we need out there in those areas.
Will this be brand new owners, or is this for existing owners that want to expand in rural areas?
So just like the Pathways program, we'll be looking for a diverse group for our first cohort. So it'll be people who are opening their first one. It can be people who are inheriting a pharmacy. It can also be people who want to expand and just haven't really looked at all of those things that you need to think about when opening your pharmacy. Maybe they need a refresher. So we have all of those different kinds of people in the current Pathways cohort. So anybody like that is welcome. If you're going to open it in the next 3 to 5 years, you're getting into a partnership in the next 3 to 5 years, anything like that, definitely apply.
All right, listeners want to get involved. Where's the best way to get a hold of you and the team at the foundation?
Yeah, ncpafoundation.org is a great place to go, is our website. You can see ways to give on there. You can also see our programs, the things that we're prioritizing. Right now during convention, obviously, we have several fundraisers going, raffles, so a lot of exciting stuff you can get involved in.
Sonia, thanks for taking your time to be part of the NCPA's post show. We love talking to you, and I got to get you on Twerks so we can talk This Week in Pharmacy.
We will. We'll do that again soon.
All right, thank you.
Thank you.
Wyatt, you're back on the Pharmacy Podcast Network. It's so good to see you.
Good to see you. I had to walk over and introduce myself and put a name to the face to the name. So, Good to see you.
Talk to me about your pharmacy, Walker's Pharmacy, this is
Livonia,
Louisiana.
Livonia, Louisiana.
How far away is that from New Orleans?
I'm an hour and a half.
Oh, that's nice.
Yep.
You don't have to be that far
Pretty
away.
easy little drive in. Yep.
Are you staying here or are you going home?
I am staying. Just a little too far to drive back and forth, but
right.
Got a few things to do here, so.
Talk to me about your pharmacy. I love listening to pharmacy owners to kind of share innovation, what you're doing, and how you're thriving.
So yeah, I mean, we trying our hardest to expand beyond the prescription, like we always talk about. Right now, immunizations is wide open with the flu, and then you're seeing tons of other opportunities for immunizations. We've established some clinics, if you will, over the years with some local businesses, the schools, a couple nursing homes. So that's going right now. With the CPSN BI 2.0 in the mix right now, trying to ramp up our MedSync programs. Started a pharmacy care at home program since the last time you and I talked, or we were probably in the process of that. Trying to ramp that up and figure that part of it out.
Now, are you providing some home care services like bathing, cleaning, and doing things, or is it strictly clinical?
So, ironically, I've invested in Happier at Home.
Nice.
Yeah. So
shout out to Debbie Marcella.
Yep. So we started that the beginning of this year. Takes time to get that established, but we're picking up some clients and adjusting to that. That's a whole different world than what we're used to doing in the pharmacy. So yes, we are doing that type of, we do companion care mostly. Louisiana is a little different licensure-wise and what you're allowed to do without a license. I can do those things without licensure, so that's what we're doing. Trying to figure out a way to incorporate some pharmacy services, in talks with Preventive Healthcare Solutions about remote monitoring right now. We have some things in the works with them. Trying to also figure out how we can incorporate that into our home care patients. Got some local home health care agencies that are interested in the remote monitoring and using those devices for their patients, and lots of things going on, lots of potential, let's just say. It just takes a little time to get all that established and in the works and fitting in your workflow and all that thing.
All of the things that you're mentioning are a way to continue to grow the business of community pharmacy and stay independent and stay entrepreneurial. And a lot of that comes back to creativity of the owner kind of driving it, but then kicking it off to somebody internal that is kind of the stronghold of that, whether that's operations or inventory or data management or whatever it is. Talk to me about how you're leveraging your pharmacy technicians and how you're turning pharmacy technicians more than just technicians. They're actually becoming pivotal to growing the business.
Yeah, so unfortunately, I just lost one of my key technicians in the last couple months to another opportunity, but she was a community health worker. She was my champion for my MedSync program, running MTMs, getting those ready for my relief pharmacists, or those types of things. But I do have a technician actually here in New Orleans this weekend training for the community health worker program with Jake and David and that crew and Trip. So that's in the process, and she's kind of my next in line. We actually participating in the rural cardiovascular study that's going on through Health Equity, so I think we're one of 25 pharmacies in the nation that have that contract or can participate. So I'm looking forward to that. So that's part of the process, her doing her training for that, that program that we're going to be doing here shortly. So yeah, I mean, we try to use the BI like I talked about earlier to find out what patients are our best suitors for MedSync, and eventually we're going to use it for pharmacy care at home patients, and then hopefully down the road we use it for cash pay patients. Option in talks with Dave with Benry Health, with the Simple Step program. I'm not sure if you've heard of that, but just membership type model with tiered drug pricing, things like that. So hopefully down the road, this BI, and that helps us just continue to grow in that arena and keep expanding. It's a challenge. I mean, it's a lot of work.
Absolutely.
my wife is, we talk about it a lot. She's like, you're going to work yourself to death. I mean, I just hope that we get through this transition phase and it pays off down the road. That's my goal. But I mean, it's just a lot of work to get to that point. But I think it's necessary work to, if we don't do it, it's going to, we don't want to see the other side of that. So
Great.
Yeah.
Well, I appreciate you being on the NCPA 2025 show. I enjoy talking with pharmacy owners and getting some of the clarity of what the future looks like for independent community pharmacy. And it sounds like if you don't have hustle on and going and trying things and building stuff, it's not a business anymore that you can just do the standard prescription.
No, it's not. But the cool thing is, like, establishing these new, the Happier at Home, the pharmacy care at home. What it's done for me is, I mean, I've been in some of my clients' houses, and you see there's a real need. Like in the pharmacy, you know it, but you don't see it firsthand.
Yeah.
You see it when they walk in the door, but you don't really see what's going on at their house.
Right.
When you go in their homes and see what they really need and how big of an impact you can have, it's powerful.
Yeah.
My wife's a registered nurse, and she's gone in those homes when we didn't, maybe our caregiver couldn't make it, and help out, and it's pretty powerful to see. So it's encouraging to, it's motivating to try to just continue to grow and do better and be more of a resource for them. We get so caught up in that fast-paced pharmacy behind the counter, you really just don't have time to even think about anything else. Hopefully all these things give me that opportunity to step back, manage things, and really build a real patient, hub. Great idea last night by another pharmacy. They have what they call a wellness hub or wellness center in the pharmacy, and it's basically his champion technician that's her job, is just to take care of their patients, whatever it is. And she's a community health worker. Like, that's the goal of what I envision, my pharmacy being like. It's just a great to hear it and to meet his tech and listen to her stories. It's motivating to. It motivates you to try to get to that point,
Absolutely.
So, but yeah, I mean, pharmacy, I think the future of pharmacy and healthcare is being in those patients' home, whether it's you or somebody else, right? So
True. Wyatt, thanks for being part of the show.
Yep, appreciate it, Todd. Good to see you.
All right. Hey, have you heard of the Patient Protector? Have one of the founders here, Bill Schmitnick, who has been a friend of mine since meeting him, based on the national news that Bill and his family made with the loss of his son, Cole, and the PBM shenanigans that really caused that to take place, which was an absolute horrific story. Blossoming out of that horrific story is a beautiful story, and it's the commitment that Bill and his family has to changing the game and changing the role of what the PBM was supposed to be like. Bill, welcome to the show.
Well, thank you, Todd. Glad to be here, and I'm glad to be back, honestly. Your support of our mission has been excellent, so thank you.
Hey, I want to tell you a quick story. One of my dear friends, he passed away about 5 years ago. His name was Dom Meff. Dom Meff was an entrepreneur. He was out of Greensburg, which is the Pittsburgh area. He was very committed to pharmaceutical excellence and sometimes the development of different pharmaceutical studies. His family, his two sons, are still in the pharmaceutical market, so he's really passed on legacy. Dom told me the story of the original purpose of PBMs, that he actually, one of them, he helped to start. He started one of the largest PBMs in the country back in 1983. And it was for the steel industry. So Pittsburgh, obviously, huge steel town, and they had, for the steel workers union, they had this PBM that they designed. And he said that there was a lot of meaningful value to a PBM back in the day where you paid 30 cents per prescription. They organized formularies. They organized buying, kind of like metrics. They helped the pharmacists. They helped the health system. It really made a lot of sense. That's been bastardized. I mean, that has become a monster of greed-filled organizations that have nothing to do with customer service or have nothing to do with client-patient care. It's all about this money. And unfortunately, because of those models, you lost your son because of that. Talk to our listeners about what you've learned about the PBMs, which, by the way, 5 years ago, you probably didn't even know what a PBM was.
I'm going to tell you this. It's about 620 days ago, I didn't know what a PBM was. And what I've learned, what my wife and I learned, was just jaw-dropping, and almost to the point of, are you kidding me? This couldn't be possible. And what we learned is that the profits do come over patients, and it's very deep from there. It's very complex by design.
Yep.
And back to your little opening there, yeah, PBMs were brought online for a very well-intended purpose. Mm-hmm. Just think about the simplicity of this. You're an employer. You got 500 employees. They all go to the pharmacy today, yep, and they're all different. Are you going to write 500 checks? No, you're not.
Right.
PBMs would, like a centralized billing type stuff, and then formulary management, like you said, came into it. And the biggest thing that we learned was, as the industry grew as a PBM, and they would go to Congress and get certain exemptions. Like, for example, in 2003, when prescriptions became more of a government thing. Mm-hmm. We'll just say that. That's a very terrible way to explain it. Long and short of it, in 2003, when they started managing the prescriptions, that's, just anti-kickbacks,
Yep.
and 60% rebates forced from the PBMs, and it just ballooned from there. And then, then they 2014 Affordable Care Act came around. Mm-hmm. Cost to service we get the bill off of, so we can be better. And it is insane that our government approves this, but it's not just like they're just approving it. There's these little birds chirping in their ears. They're called lobbyists. Mm-hmm. And when you spend millions upon millions of dollars talking to your legislators about how great you are, you're going to get some legislation towards you. Yeah. And until the patients and the pharmacists at the independents stepped up over the last couple of years, the voice is changing now, and we're on our way to making some change a little bit. And I know I kind of avoided your first question a little bit there, but that's what you've learned. I mean, there's just nothing but games and tactics, mafia-like tactics, quite honestly. Yeah. PBM steering, they want to make more money by having you go to their pharmacy.
Yep.
Step process. They say it's for your benefit to get an equally preferred drug to save some money. Well, from my personal experience, just about 3 weeks ago, I had to go to a new insurer, a new PBM. I was on a generic form of Advair. I'm now on a name brand form of Advair that I needed prior authorization on. So I'm not saving money by buying name brand over generic. My employer's not saving any money getting a name brand over generic. Oh, wait, there's a little caveat right there. Guess where the rebates go? On the name brand drug. So that drug is on the formulary because the manufacturer was forced to pay a rebate to get better placement on the formulary or the drug list for me. So the generic drug doesn't get sold. I don't save the money. My employer doesn't really save that money. They might, depending on the PBM, get a little bit of that rebate, maybe. There are some transparent PBMs that are doing better, but for the most part, it's not that good a deal.
Yeah.
Name brand is not cheaper than generic.
Yeah.
So, and that's happening today. That happened to my son back in January, on January 10th. The same thing happened to him, and it's still happening today with the same PBM.
Mm-hmm. That's horrible.
Yeah.
Hey, you have a documentary. Dan Strauss, shout out to you for working so hard on this, Modern Medical Mafia. Talk to us about this documentary, but then also talk about the controversy of one of the largest publishers that pulled it because the PBMs once again got in their ears to have it stopped.
Absolutely. So the day we figured out what a PBM was when Dan, the gentleman who helped get the docuseries produced, stopped at our house. And we had a discussion, me and my wife and him. He taught us what a PBM was that day. It was a shocking day. I can tell you, Dan was driving home in tears after hearing Cole's story and knowing the pain we were in. He called his movie producer friend of his and said, we've got to make this docuseries. I mean, on his way home. And Modern Medical Mafia was born that day. And what that transformed into is we created episode 1 of a docuseries that will have 7 to 8 more episodes very soon. Episode 1 is live on YouTube right now. But why are we on YouTube? Well, we were on Prime Video, and it was doing pretty good. 26,000 views already. It's all good. Myself and Dan actually testified at an open committee hearing about PBM reform. The next day, Prime Video takes our video down. Vimeo takes our video down.
Oh my gosh.
And we were just like, what the hell? You know, didn't really know why. And no reasoning from them other than it doesn't comply with our standards. It complied a month before that when we submitted to whatever. And the New York Times heard about our little debacle. They got a hold of Dan and the producer. Actually, that was in the article. Dan and Mary, the producer, is his daughter. It's an awesome, amazing family affair is what we got here. We are grassroots beyond belief. I mean, like, we are, I don't, like, I mean, like, this comes out my pocket, this comes out of Dan's pocket.
Yep.
And, but New York Times interviewed Dan and Mary, and then, thank God, they threw a little something on the front page of the New York Times talking about United Healthcare silencing their people that are saying they're doing wrong. And we felt no more pressure since then. We can't get it back on Prime Video right now because they're still just playing the game. They're afraid they're going to get sued, I assume. But we're going to continue. We've got a second episode coming out any day now. And if they didn't like the first one, they ain't gonna like the second one or the third one, all the way up to the 8 that we have planned, because we are going to continue to talk. We are prepared for many things. If we get censored off YouTube, it could happen. We will have a way to overcome that. And the biggest thing that we added to our Modern Medical Mafia page on YouTube is there's 60 now, over 60 1 to 3 minute videos on anything PBM healthcare related that's correlating with the docuseries, and then some. If you don't know what the step process is, and you think about that is, I don't even know the percentage. How many Americans every day have to go through the PBM step process after visiting their doctor? Probably at least one a day, we'll say. That's explained if you don't know what it is. All the way to the employer aspect of it, fiduciary responsibility. PBMs use that all the time to get lawsuits dismissed because it's the self-insured employer who actually picks that formulary, but yet they don't realize they're getting kicked under the bus if you get sued. So it's all explained in the videos, but the reality of Modern Medical Mafia is it follows the mission of Patient Protector: educate, enrage, engage. That's how that was developed and built. So we're going to show you the facts. We're not going to lie to you. I mean, like, it's factual. I mean, like, you can verify every single source of anything that we put on our site. There's a verifiable source. To be true to grassroots and truly, my wife and I, our mission was, after we figured this out, to make sure no one else dies like Cole. So we're well on that mission. Modern Medical Mafia is on that with us. If you haven't seen the docuseries, go to Modern Medical Mafia's YouTube page. The ampersand MMM docuseries gets you right there. Or you can go to patientprotector.us, click a simple box, it'll lead you right to the Modern Medical Mafia. Probably watch that first episode, because guess what? The second one's coming. So,
that's great.
Yeah.
Well, we appreciate you giving us an update here at the NCPA 2025. This is a post show. We are going to have you back on This Week in Pharmacy, and we're going to talk more about the Modern Medical Mafia. Bill Schmitnick, thank you so much.
Todd, thank you again.
Hey everybody, Christina O'Connor, registered dietitian with Pendulum Therapeutics, and you're listening to the Pharmacy Podcast Network.
What
is Pendulum? We've just been standing here. We've been with the Real Value booth here at the NCPA 2025, and right across from us is the Pendulum booth. I have Christina here with me. Christina, introduce yourself to our listeners, and let's talk about Pendulum.
All right. Hi, everybody. I'm Christina O'Connor, registered dietitian with Pendulum Therapeutics.
So, your colleague was telling me a little bit about this. You work closely with pharmacists. What is it that you do, and how are you helping to amplify pharmacists' effectiveness with their patients, specific to whatever you guys are really dialed into?
Yeah, well, Pendulum's a really unique company. So I don't know if your audience is familiar with the Akkermansia strain, but it's a keystone organism that when we see it missing from the human gut microbiome, we see a lot of negative downstream effects in human health. So it's implicated in a lot of different disease states and conditions in the literature, but it's an anaerobe. So that means that it can't be exposed to even a single molecule of oxygen. It lives in the colon, and Pendulum was the first company to successfully grow this anaerobe and make it available in supplement form. So we're really on the cutting edge of innovation in the future of probiotics, so not offering the same lactobacillus and bifidobacteria strains that people are used to seeing on the shelves, and really bringing these innovative keystone strains in supplement form.
So with several of our projects over the last 16 years of podcasting, we would take a specific issue, a specific disease state, and then we would bring in experts and we would do things. I could see pharmacy owners in the community space communicating to their community, whether that's social media or some way to get out, that there's going to be 7 o'clock on a Wednesday night, there's going to be this gathering of people that are interested in really understanding what is the truth about probiotics, brought to you by Pendulum or something. But how are you teaching, how are you coaching pharmacy owners to get this messaging out to their community?
Great question. So we actually have a double-blind, randomized, placebo-controlled trial in type 2 diabetes, looking at our strains, and they effectively lower A1C and after-meal glucose spikes. And so that's a great community that can really benefit from taking our organisms. You're essentially restoring the bugs that are meant to do those functions of metabolism, but then additionally, the strains help with gut barrier integrity. So that helps to reduce inflammation in the body, helps to reduce GI symptoms, GI discomfort. So there's actually a broad audience that can benefit from our strains.
Is there different type of Pendulum substances that a patient would take, or is it one substance for everyone?
It's Akkermansia and a group of butyrate producing bugs, and all of our products, they're very similar in the same strains and different potencies, but generally the same goals.
Pharmacists have an opportunity to become the hub of healthcare within communities, so this fits. What kind of training and or co-marketing are you able to do with a pharmacy to kind of get this going as a product that they would carry?
Yeah, that's another great question, and something that we've been really successful at doing. Our pharmacies that currently carry our products, we educate extensively their pharmacists. We do lunch and learns or coffee dates or breakfast and learns to talk about the current research, to talk about deep dive into the science, to talk about the products. And then we have beautiful in-store marketing assets. You can create like a little Pendulum corner. We provide all of the assets, and then even beautiful digital marketing assets. So if you want to do an Instagram Live or a podcast, I can be your guest, and we can, educate your community and your audience on the science and, why these strains would benefit them.
This is great. Well, we're interested. You have my ear. We have 40 plus podcasts to get you involved in digging down into specific things. So we'll definitely be following up with you. It was so good to meet you here at the NCPA 2025. How has the show been for you so far?
It's been great. We've met a lot of wonderful people. We're thrilled to be here.
That's terrific. All right, what's your next conference? Because we go to 8 to 12 per year, so what's your next one?
Oh boy, we'll be at Eudaimonia, which is a consumer-focused conference, but then we'll be at A4M in December in Vegas.
Very
Who
good.
doesn't want to go to Vegas in December?
A big one.
Yeah.
I don't like Vegas, but I have to go because there's so much going on there when it comes from business. Christina, thank you so much for being on the show.
Thank you.
If you are an independent, chain, or specialty pharmacy looking to compete in a digital-first world, it's time to meet NimbleRx. Nimble is a pharmacy technology platform and mobile app built to modernize the prescription experience without forcing pharmacies to become tech companies. Designed specifically to help local pharmacies compete with giants, NimbleRx brings traditional pharmacy operations online fast. For patients, NimbleRx makes managing prescriptions simple. They can track orders, manage refills, view medication history, and choose convenient same-day or scheduled delivery, or easy in-store pickup. Patients can even sign and pay digitally through a secure HIPAA-compliant checkout using credit cards or mobile wallets. No phone calls required. Automated text and email reminders ensure prescriptions are never forgotten. For pharmacies, the impact is real. NimbleRx helps drive revenue growth through increased refill rates and digital OTC sales, while boosting efficiency by automating refill outreach and payment processing. Best of all, NimbleRx integrates directly with existing pharmacy management systems, so pharmacies don't have to rebuild their workflow. Security matters too. NimbleRx is fully HIPAA compliant, uses encrypted payment processing, and signs business associate agreements to protect patient data. Learn more by going to our website at nimblerx.com. That's nimblerx.com.
Maya, introduce yourself to the NCPA 2025 post-show. Talk to us about Maya.
It's a pleasure sitting here with you, Todd. Thank you for inviting me here. We're exhibiting today for 3 of our companies. RX2Go, which is a delivery service, courier service. Second is RX4Route, which is a software that helps pharmacies, especially in the long-term care, with getting the delivery successfully to patients, as well as helping drivers to complete the delivery as the way it's supposed to. And then third one is a pharma staff, which is outsourced staffing. By that, you can have, if you're a pharmacy owner, for instance, you need a staff who can actually help drivers with, if they're at the patient's door and no one's home, it's a face-to-face signature required delivery, they can assist them by, reaching out to the patients with their, extra phone number if they have, or reaching out to the doctor's office and then getting any other phone numbers where they can reach the patient and get it, successfully delivered. It's like data entry or billing, something that someone can do even from home. And you can have that full-time staff for only as low as $1,500 full-time, right? Just you paying for the person.
And the importance of the portfolio of services that you're presenting is giving pharmacists the tools that they need to be a little bit more profitable. And something that I'm very excited about, we've worked with RX2Go several times, we've worked with pharma staff. What I'm excited about is the expansion of community pharmacies business has to meet people where they're aging, and they're aging in their homes, okay? So we're not even if you think of the demographics of the United States, we're not at the top of the baby boomer age. We still haven't reached the top yet. So therefore, there's not an expansion, there's not a huge expansion of nursing homes. People don't want to go to a nursing home. They want to stay in their home. So if a community pharmacy has a reputation in their community and they have a patient that is now 72, 75 years old, they can't really come to the pharmacy because something's going on. The community pharmacy is now able to deliver their meds to them, but also put them into a long-term care at home environment because the reimbursement for those services are higher than a community pharmacy direct reimbursement is. So that's huge. And you guys are a business platform that's going to help them kind of develop that. So talk to us about some of the pharmacies that you've worked with that are transitioning deeper into delivery and deeper into long-term care at home.
So with Me being in this industry since 2018, I've seen that now more and more pharmacies do offer deliveries, and they don't just do like local. They do the whole state, right? For instance, pharmacies somewhere in north of Jersey is going all the way down to Cape May, right? South Jersey. And they do deliveries. And this is where Rx2Go comes as price efficient, reliable, and fast. And on top of that, we take pride on communication that we provide. There is between patient, the pharmacy staff, and our call center.
Yep.
And we provide same day, if it's a same day delivery service that needs to get to the patient. For example, it's an antibiotic, needs to get to the patient same day. So we pick that up by 12:30 p.m. and guaranteed delivery by 9 p.m. that same day.
Excellent.
Anyway, in, let's say, state of New Jersey. And second service we provide is next day. So if we pick up all the packages, all the prescriptions that are going to patients, deliveries by pharmacy's closing time. Let's say if the pharmacy open hours are 9 to 7, so we pick up from 6 to 6:45. Pick up all the packages, scan them in the system. Let's say if the pharmacy has 100 packages ready, we scan all 100. If we scan, let's say 90, the driver will say, I have 10 missing. So that way we know that we're not leaving anything behind. And then what we do is that we deliver everything next day. For example, we picked up today, Friday, we deliver everything tomorrow, Monday, from 8 a.m. to 9 p.m. We text to the patients 3-hour ETA. Like you said, a lot of patients are seniors.
Yep.
We do call. So we have an automated call, and we have a real human calling and confirming the address, telling patient where it's coming from, which pharmacy it's coming from, and what time it will be delivered, who will be the driver, right? So they expect who's coming at the door. And then the third one is time and know next day, where some patients would like to know what time they should expect it or they're comfortable with. And the pharmacy can choose. It's a next day delivery, deliver it anytime from 9 a.m. to 1 p.m. And we guarantee that it will be delivered to the patient anytime from 9 to 1. And same thing, we do call and text and communicate and let the patient know. For example, driver's about 30 minutes ahead, and he should be by your door. His name is, let's say, David.
Yep.
He'll be in a blue vest and an ID on, so they know who to expect.
It's very professional. What about the pharmacy management system? Talk to me about integration. Which systems are you integrated with, just as examples of the pharmacy systems that you're plugged into?
So as of now, we're plugged into Pioneer. It's real-time two-way integration. By that means the order comes to us directly from Pioneer. To us, it's only patient's first name, last name, address, phone number, and direct numbers, just so you guys have the history. I mean, the pharmacy will have the history of it. And then once the delivery is completed, real time, when I say real time, is latest within 3 seconds, the receipt with the patient's signature on it will be sent back to Pioneer and complete the delivery.
Okay.
And then we have PrimeRx, also known as micro merchant systems, and then also two-way. And then we have it with Liberty and BestRx.
Framework LTC?
Yes, it's about to be completed, but we're almost there. And that's why I didn't mention it.
No, but I wanted to shout them out. They're on our network, so they do some amazing podcast productions. And we were at their event with you, and we saw Donnie there. He was one of the speakers. So it was really fun to see that relationship blossom and how important long-term care as a focus is for your organization. You guys are big supporters of long-term care.
Yes, and we take pride on that. And another pharmacy software which a lot of hospitals use, and we actually well known in the industry for doing deliveries for hospitals as well. We are SOC 2 compliant and certified. And then we have integration with Epic.
Okay.
So
very good. That's a huge electronic health record.
Yes, and we actually the first one who got approved and inside Epic. Yeah.
It's terrific.
Yeah.
Well, I want to thank you. I want to thank your team. You've always been just open for collaboration. The technology is really impressive. I like hanging out with you and your team. We got to go to dinner last night. I want to thank you for that as well. And I want to thank you for being on the NCPA 2025.
Thank you. We're excited to be here. We have been here last year, and we're here this year, and we will be every year.
Very good. We'll see you next year.
Thank you. Thank you, Todd.
We're here with Johnny Rossetto. Excellent, from University of Pittsburgh. Are you a P?
I'm a P2.
P2.
Yeah.
All right, so talk to us about the future of pharmacy. What do you see happening in the industry where you're like, hey, listen, I want to do this, this, or this?
Yeah, I think something that really attracted me to pharmacy to begin with is kind of the changing landscape that it's been going through and the diversity of opportunity. And I've kind of got an interest. I'm leaning towards ambulatory care, but finding that intersection within the community I think is really important, and seeing, I think, being able to incorporate more like point of care testing and more patient-centered services in our community pharmacies is so important, especially in underserved communities. We're from PA, especially around Pittsburgh. There's so many underserved areas that don't have, immediate access to healthcare services, and so having these institutions that have multiple services available to their patients can really improve health outcomes. So I'm really interested to see how that's going to change, and I've definitely seen a lot of that here. We've had talks at Pitt as well at this conference, leaders in the community trying to incorporate these new services into their independent pharmacies so that they can better serve their patients.
Excellent. So the National Community Pharmacists Association has gone through drastic changes, keeping up with the times, and what a community pharmacy will be doing today that they weren't doing 5-10 years ago. So why do you come to the NCPA? What is it about this conference that you're excited about?
Yeah, absolutely. So I'm a new member at Pitt with the NCPA, our student chapter. I'm serving as a legislative chair, so I have a passion for policy and advocacy as well. And that's something that drove me to come and kind of learn more about, especially, the fight against PBMs currently and kind of how that landscape is changing, because a lot of legislation is being enacted in many different states trying to kind of improve the services for our patients and reduce the cost burden on them, as well as our pharmacies that are struggling at the moment dealing with that issue. So that was definitely something that really drove me to come to this conference and learn more about. And also I just wanted to learn more about community pharmacy in general, because again, I'm kind of like at a crossroads in terms of figuring out what I want to do with my career post-graduation. And coming to a conference like this, having the opportunity to, and speaking to so many leaders in the community pharmacy field, really allows me to get a better understanding of what's available to me and how they envision the field changing moving forward. So it's been great being able to talk to so many inspiring people here at this conference and allowing me to get a better understanding of what my options are moving forward.
Johnny, thanks for being on the NCPA 2025 post show. We appreciate it.
Yeah, thank you. I really appreciate the opportunity to talk to you. Thank you.